While many Hoosier doctors are on the front lines of the pandemic, many others have been sidelined, and it's impacting the ability for some healthcare practices to survive the COVID-19 crisis. That's one finding from a new report looking at the business impact of COVID-19. The Indiana State Medical Association is sharing the results first with us here at Inside Indiana Business. Business of Health Reporter Kylie Veleta tells us what that survey uncovered. Kylie, over to you.
Thank you, Gary. ISMA surveyed thousands of Hoosier doctors and found the health crisis is putting an economic strain on medical practices throughout the state. 73% of physicians say they've reduced staff hours or had temporary layoffs. More than half of those doctors expect to eliminate positions in the next 2 months. Here to tell us more about how COVID-19 is impacting business and patient care is Julie Reed, the ISMA Executive Vice President. She joins me now via Skype. Julie, thanks for being on the show today.
Thanks for having me, Kylie.
Well, first of all, why did the ISMA want to do this report? What are your goals?
Sure. So let me just say how really fortunate we are to have great doctors in the state of Indiana and other healthcare providers who really have been just heroic during this public health crisis. Obviously, all individuals have been affected by it, and all industries have been affected by it, including healthcare. So what we really wanted to do was to determine what has been the impact on physician practices so that we could determine how to help them reduce those barriers with their patients. At the end of the day, this is about access to healthcare, and we want to really make sure that we prevent delays to those important screenings and procedures that patients need.
Okay, there are some alarming insights in this report. 82% of doctors report more than a 40% decrease in revenues and patient encounters. Some report 80 to 90% loss in revenue and potentially closing their practices. As the ISMA looks at the results of this report, what are your top concerns?
Sure. So it really has been feast or famine for healthcare, believe it or not. We have some healthcare providers that are on the front lines and directly involved in the COVID response. And then we have, as you've mentioned, other healthcare providers that have seen dramatic reductions in patient volumes. Some practices have seen, almost all practices have seen over 40% reductions, some 80 or 90%. And so what's alarming to us about that is that means patients are not seeking the care that they need. And obviously that's not just for sick patients, that's obviously for the important screenings and things like vaccinations that we need that's part of our fabric of our primary healthcare system.
So we've talked about the business impact. You mentioned patient care. That's a big issue right now. You also mentioned access to patient care. That's frustrating for a lot of patients right now. What is the message that you want to give to the public with this report?
Sure. So, obviously we've seen the public affected by this dramatically. People are facing some of their hardest days and some of their hardest times. And we really need to make sure as a society we're there for all of those people that are facing hard times. From a healthcare perspective, we need to continue to remind people that healthcare continues to be important, COVID or not. People need to be attentive to their own healthcare needs and the healthcare needs of their family members and really stay in contact with their doctors during this.
Telemedicine, you mentioned, is off camera, definitely on the rise right now among doctors. A lot of them using telemedicine.
It absolutely.
Right. So we have a slight delay between us. The ISMA has said publicly they support the governor's decision to close practices, but there have been some unintended consequences. So what is the ISMA message for the governor right now and state leadership, even as some of these elective procedures are starting to be allowed now?
Sure. Well, we couldn't be more pleased with the leadership from the governor and his entire administration team, including the physician advisors who he's been working closely with. We are pleased to see elective procedures gradually start to open again. We think that's important for patient care. We've also, as you noted, been really pleased with telemedicine, which is this notion that patients kind of might see their doctors through a video visit on a computer, a tablet, or a smartphone, or maybe just connect with their doctor over an ordinary telephone. We've seen physician practices really adapt. We said a 70% utilization rate amongst practices for that, which we're really pleased with. On other fronts, we've had some challenges around personal protective equipment and access to masks and things like that for physician practices. Those are starting to improve, and we're pleased that the state has agreed to kind of help work with us to coordinate getting those for physician practices around the state. We're also pleased to see increases in access to testing, which will really be important as we start to think about reopening as a state. Overall, what I would really say is we've been really impressed by what I would call kind of the spirit of collaboration and innovation, and hope this is just the beginning of that.
All right, Julie, just a very couple seconds left. What do you want to do next? How do you move forward with this report, with the information you've been given?
Sure. So we're working on guidance for reopening practices, and really we need to restore the confidence in the public about going out and getting the health care they need, potentially even through telehealth. We're encouraging patients to check in for their checkups with their doctors and make sure their health conditions aren't getting worse during COVID-19.
Okay, Julie Reed, thanks so much for joining us today. We do want to mention the report is on the ISMA website. That will happen later this weekend, so you can see the report in full. Julie, thanks for being on the show today.
Thanks again for having me.
Gary, back to you.
Kylie, thank you. A great report, information you're seeing first right here on Inside Indiana Business. Thank you.